Signs and causes of ectopic pregnancy. Symptoms of an ectopic pregnancy. Although you may experience typical signs and symptoms of pregnancy, the following symptoms may be used to help recognize a potential ectopic pregnancy. Sharp stabbing pain that may come and go and vary in intensity. The pain may be in the pelvis, abdomen, or even the shoulder and neck due to blood from a ruptured ectopic pregnancy gathering up under the diaphragm. Vaginal bleeding, heavier or lighter than your normal period. Gastrointestinal symptoms. Weakness, dizziness, or fainting. It is important to contact your doctor immediately if you are experiencing sharp pain that lasts more than a few minutes or if you have bleeding. 3 classic signs and symptoms of an ectopic pregnancy. The 3 classic signs and symptoms of ectopic pregnancy include abdominal pain, the absence of menstrual periods, amenorrhea, vaginal bleeding or intermittent bleeding, spotting. However, about 50% of females with an ectopic pregnancy will not have all 3 signs. Other signs and symptoms of an ectopic pregnancy. The woman may not be aware that she is pregnant. These characteristic symptoms occur in ruptured ectopic pregnancies, those accompanied by severe internal bleeding, and non-ruptured ectopic pregnancies. However, while these symptoms are typical for an ectopic pregnancy, they do not mean an ectopic pregnancy is necessarily present and could represent other conditions. In fact, these symptoms also occur with a threatened abortion, miscarriage, in non-ectopic pregnancies. The signs and symptoms of an ectopic pregnancy typically occur 6 to 8 weeks after the last normal menstrual period. But they may occur later if the ectopic pregnancy is not located in the fallopian tube. Other symptoms of pregnancy, for example, nausea and breast discomfort, etc., may also be present in ectopic pregnancy. Weakness, dizziness, and a sense of passing out upon standing can, also termed near syncope, be signs of serious internal bleeding and low blood pressure from a ruptured ectopic pregnancy and require immediate medical attention. Unfortunately, some women with a bleeding ectopic pregnancy do not recognize they have symptoms of ectopic pregnancy. Their diagnosis is delayed until the woman shows signs of shock, for example, low blood pressure, weak and rapid pulse, pale skin and confusion, and often is brought to an emergency department. This situation is a medical emergency. What causes an ectopic pregnancy? Ectopic pregnancies are caused by one or more of the following. Previous surgery in the pelvic area or on the tubes can cause adhesions. Abnormal growths or a birth defect can result in an abnormality in the tube's shape. An infection or inflammation of the fallopian tube can cause it to become partially or entirely blocked. Scar tissue from a previous infection or a surgical procedure on the tube may also impede the egg's movement.